Let's go further into the study though, because even within the same study that they cite, the problems with their claims go even deeper. This study did the statistics 2 different ways, and one of them didn't show anything. First, they used a cutoff method, like what we've been talking about, comparing those above and below 23. But then they also did an analysis on what's called a continuous basis, meaning did people with a bicarbonate level of 24 have a slower speed than people with 25, and was 25 slower than 26, and so on? Or was it just a threshold effect of abnormal versus normal? And what they found is that it was a threshold effect. The authors themselves even say that right here. You can see in this table the continuous analysis showed no effect. When you're reading a study, pay attention to the part that's in parentheses here. That's what we call the confidence interval. If the bottom of the interval is below 1 and the top of the interval is above 1, it means that there is no statistically significant effect seen in this analysis. What this means in real terms is that if your bicarbonate level is so low that it's abnormal on the lab test machine being used, then that is correlated with slower gait speed and decreased quadriceps strength. But if it's normal, there's no significant difference between levels in the normal range. I mentioned before that the reason they chose gait speed and muscle strength was because those correlate very strongly with the risk of mortality. So wouldn't it be weird if someone had looked at this same data set and realized there was no correlation between bicarbonate levels and mortality in people that do not have other diseases? Well, in fact, someone did look at that. In this study, they looked at people who have low serum bicarbonate levels, below 22, but no kidney disease, and there was no indication of increased mortality. But what if we don't actually care about mortality? We just genuinely care about not walking fast and having weak quadriceps. The authors themselves state that additional studies would be needed to determine whether alkali treatment would improve gait speed and quadriceps strength. Once again, that study does exist, at least in people with kidney disease and low bicarbonate. This is the real type of evidence that we're after, right? A placebo-controlled randomized trial to see if correcting low bicarbonate levels improves physical function. Unfortunately, this study shows that supplementing with bicarbonate versus placebo had no impact. So here, in a real study, we see once again, just like homocysteine, the observational bullshit turned out to be nothing more than a biomarker bamboozle. And lastly, I'll say, you know what really improves walking speed and quadriceps strength? I'll give you a hint. It isn't bicarbonate. Now, later in the video, they briefly recommend leg strengthening, but there's a lot more emphasis on their supplement protocol. And to me, this is where it gets kind of shady. These guys don't recommend taking bicarbonate because recommending baking soda isn't sexy. No. He's designed a protocol because we need some razzle-dazzle fallacy, and protocol sounds sexy. And what is the protocol? It's not baking soda. No. They talk about base loading with potassium, calcium, and magnesium, none of which have any significant effects on pH, especially at the small doses involved here, as well as green drinks or whatever magic bullshit herbal powder capsule they're talking about. Aside from the fact that that's nonsense, even if it did work to raise bicarbonate levels, the whole thing is absurd because they're trying to improve a level that doesn't matter, that doesn't respond to treatment, that doesn't correlate to mortality or even dysfunction in people that are in the normal range or don't have kidney disease. Of course, it's still a biomarker bamboozle, but they're building onto it to get the full quantified quackery bullshit sandwich. On top of the razzle-dazzle fallacy, they've added in what I call the TLDR fallacy, also known as I'll just read the abstract. The actual study is too long and too complicated to read, so they couldn't be bothered.